Okay, I think I'm going to go ahead and get started and start with the housekeeping. We've still got people rolling in, but I want to be respectful of everybody's time, and we do have a good amount to cover this morning. So first, thank you to everybody for being here. I'm Alex Moore. I'm the Director of Marketing and Communications with United Way of the Piedmont. And this is our first ever virtual coffee and conversations. So we really appreciate you guys being here. Hope and any grace that we may need with technology. This is, again, the first time we're doing it this way. So thank you for being here and thank you for your patience. But fingers crossed, technology works with us today. So I just want to go over a couple of housekeeping items. This is a webinar, so all of the attendees, you do not have video or voice. It's more webinar style. So we have our panelists that are United Way staff who you'll be hearing from. And then if you have questions, you should be able to see a Q&A box or a little icon in the bottom of your screen. You can use that to ask questions. So again, that's how we'll be doing questions, through that Q&A chat box, and we have United Way staff who are monitoring that. We will hopefully have time to allow for some of the questions to be answered right here live, but we are monitoring that question box. So if there's anything that we can answer for you immediately, we will, but if not, and we need to get an answer for you, or we don't have time to cover it, we are recording this webinar as well, and we are recording all of those questions. So everyone will get an answer to their questions, even if it's not in this hour of time that we have together. We will definitely follow up. So that covers question and answer feature. We do also have the chat box. If you just want to interact with your other attendees, that's there as well. As I mentioned, this webinar will be recorded. So if you want access to it, I will probably send I'll send an Eventbrite email follow-up to all of the attendees with link to that. I think covers all of my housekeeping. So with that, I'm going to turn it over to Paige Stevenson, our President and CEO, to get us started.
Great. Thanks, Alex. Well, first off, thank you all for taking time this morning to join with us to hear what we have going on and how your United Way is responding during this COVID crisis. We are really making an attempt to enhance communication and really coordinate efforts. And so probably at the end of March, mid to late March, is when we began hosting phone calls. And we've actually been hosting them for all 3 counties, just from a general information sharing perspective. One, to find out how all of the different partners were doing and what they were seeing, and then what their needs were, and to see how they might have shifted as far as how they might have been serving the community at that point in time. What we have seen is that those general information calls have led to some more topic-specific calls, as well as group-specific calls. So to give you an idea of what we have seen in that arena, we've hosted some calls regarding mental health and resiliency resources for parents, students, and teachers. I'm trying to facilitate some of those things. We've been working with the city and the county and the hospital system, as well as the homeless serving organizations, to make sure that if any of our homeless friends, whether they be sheltered or unsheltered, if they were to test positive for COVID, or if they came in contact with someone and they needed to be quarantined, how are we going to address that as a community? And those plans are in place as well. We've also brought together the faith community to have conversations about where they felt like they might be able to step in and really assist and minister to others. And then we've also been bringing together those safety net providers, those individuals who are providing the food as well as utility and rent assistance, because even though we've seen a small uptick at this point, what we know is that in the coming months that we're probably going to see a much larger wave of individuals needing assistance. And as Colin asked a question earlier regarding individuals in hotels, we do have a large number of people who are living in hotels, and so we need to be prepared because they're not covered by that eviction moratorium. And then this coming week, we will be hosting phone calls around food insecurity. What these calls have also allowed us to do is really identify some challenges that organizations were having, such as the shifting in who their volunteers were. Many had retired volunteers who were in that higher risk category, and so they needed to shift them into other lower risk volunteer opportunities so that they weren't coming in contact with public. But then also they needed to replace those volunteers. And then another issue that we've seen has to do with access to food. So even if a food bank has the money to purchase those items that they need, there's some disruption in the supply chain. And so looking for some creative ways to address those particular issues. And these calls have really helped be an information sharing and an idea sharing. One of the things that I think is a positive is this has really driven individuals to make sure that they're updating their information for their organizations on 211, because we want to make sure that when people are calling 211, that they are getting good referral information. We've also worked with 211 so that when someone calls in from Spartanburg, Union, or Cherokee counties, there is a COVID intake form that they're completing, and then our team is able to use that to assist and drive those resources. One of the ideas that became really clear in the beginning as far as helping address some of that food supply chain issues. It's the idea of going ahead and doing some drop shipping. You know, reach out, use your Costco membership, use your Amazon Smile, and purchase those items and then drop ship them to your local food pantry. We've also been using these to provide advocacy updates, because the legislation that has been coming through our local nonprofits, many of them are, you know, their head is down and they're trying to make sure that they're able to respond to the people that are coming before them. And they really don't have the time to wade through all the legislation and what does that mean for their organization and how do they need to move forward. And so members on our team, Heather Lothar in specific, has been able to spend time reading through that legislation, reaching out, getting questions answered, and making sure that that information has been passed along. And also during this time, we know that it is critical for people to be completing their Census 2020 forms. And in the midst of all of this, it would be very easy for that to get lost in the fray. And so we've really worked with organizations to make sure that that stays top of mind and in front of folks. Some of the things that we've been able to do on these calls is identify those particular needs and then have our name out there as a resource for those connections. And so a couple of things that we've been able to do, we had one of the local churches who had 200 backpacks. They weren't sure where they needed to go. We were able to reach out, find the school district and the schools that could make best use of those. We got a call from Union County Schools, and because of that supply chain being disrupted, they didn't have access to the grocery bags that they were going to need to deliver those meals to children. And so our team came together, and I'll have to give a huge shout out to Mike Witt on our team, because he got out there and instead of going to the Publix and the Ingalls who really needed their grocery bags, he went to the places like AutoZones and some of the Dollar Generals, and they were very gracious. And in a morning, we were able to collect 8,500 bags to help tide Union County Schools over until they were able to receive their shipment. Had a conversation last week with Shantae Evans at the Housing Authority. And one of their concerns were all of the seniors who live in Archibald Rutledge. And they're more in a high-rise situation. They love to socialize with one another. They're trying to keep them social distancing. But, you know, sometimes people don't want to heed those warnings. And so they wanted to make sure that they had a cloth mask for their residents. I mentioned that on a call with another group, and the Myriad Black Foundation was able to step up and provide 200 cloth masks for them. So just some really great outcomes and heartwarming things when you see others stepping up in the community. We have SharePoint folders out there with information, recordings from all of the prior calls, and so we want to make sure people are kept in the loop. So if you're interested in receiving links to those folders, please put that in the chat pod and we'll get those out to you. One of the needs too that I'll just mention that came up goes back to that advocacy piece. On one of those community calls, the need was expressed to have someone walk individuals through all of the different portions of the CARES Act, and specifically how to go about applying for the Paycheck Protection Program. And so we were able to co-sponsor with Myriad Black Foundation a presentation that was done by Institute of Childhood Success out of Greenville to walk people through how they would go about doing that, and had some really great response to that. And the final thing that we are working on, and it's no small feat, is actually pulling together a community response plan. So how are we going to respond to all of these different challenges that have been brought to the surface because of the stay-at-home orders and the closings and those kinds of things? And so in partnership with our community partners, we're pulling that response plan together. That will actually go to the governor, as well as some state level department directors like DSS, DHEC, and DHHS. And as those federal dollars are flowing back into our community or into the state, then those community plans and all United Ways across the state are working with their local communities to create those. And for those counties that don't have a strong United Way presence, the Office of Rural Health is actually working to serve as a lead there. But then those community response plans are all going to be funneled, and hopefully that will provide some, boots on the ground perspective for the governor and those state directors as they are making those decisions about how to deploy those dollars to make a difference in our local communities. So I will turn that over to Hannah and Heather now, unless someone has questions that they have for me at this point.
Nope, we're good if we want to move on to the next section.
All right,
Great.
wonderful.
Well, I'll just kind of give a little bit of background, and then I'll let Hannah get down into some of the data of what we're seeing for people that have reached out for help. So it was was almost immediate when COVID really started to hit South Carolina that families started reaching out. Particularly, the first few weeks when a lot of our restaurants closed and could only do the curbside or the delivery, that meant they could keep some people employed, but not everyone. So there was also, a lot of folks, particularly in that service industry, that were reaching out. I think we had the good fortune of learning a lot of lessons through our tornado assistance. I think all of us wished we would have probably had several months to kind of debrief from the tornado that hit Spartanburg and the assistance that we provided there, and troubleshoot and figure out, were these really the best policies and procedures before something like a COVID hit. But I think we're all grateful that we at least had the opportunity to develop some things and have them already in place. So our direct service team here, we've been doing a lot of these Zoom and meetings through Teams to talk through, because one of the things that we like to do with our process is really look at it with the continuous improvement lens, because we realize here that this is a people issue. And so we want to make sure that if we're able to provide services, which fortunately we do have some resources to do that, we want it to be a good experience, something that doesn't leave people feeling like we just created more barriers. So that's the last thing that we want to do. So I think we've been able to troubleshoot some weak spots in our policies and procedures and firm them up. And it's been great to be able to deploy assistance. We've helped probably close to 95 households at this point. And if you think about it, we're really only about 4 or 5 weeks into what could be another 4 to 6 weeks of restaurants and businesses being shut down. So we know the need is only going to continue to grow. And we're taking it a case-by-case basis. I think, the ability for us to have that direct service team that can really reach out to people and do that case management, help connect them to other local resources. So we're not in this alone. We have all of our great partners that are continuing to provide support. Of course, that food support is huge. You heard Paige mention that some of our organizations have some resources. They're just having trouble getting access to the food. It's a supply-demand issue for sure right now. So I think, as we're trying to help organizations from a capacity building, we're also working really well together, providing that direct service and connecting people to the most appropriate resource in the community. I think, people always talk about Spartanburg when you visit other communities with all of the national things that we've been involved in, and they always give us accolades for our collaboration and our partnership. And I'm so thankful for that right now, because if we were not that kind of community, I can't imagine what our response would look like. So for all of those partners, corporate, nonprofit, all of you that are listening in, we thank you so much for that. I'm going to flip to Hannah and let her tell you a little bit about that direct service piece and kind of what we're seeing and the assistance that we're able to provide. And then I'll share some resources that are on our website. Hannah?
Thanks, Heather. Hello, everyone. I'm Hannah Jarrett. I'm Director of Financial Stability Strategy here at United Way of the Piedmont, and thank you all so much for joining us this morning. So we are able to provide direct services through our community resource coordinators, serving Spartanburg, Cherokee, and Union counties. We, like Heather mentioned, we've had over 90 households already reach out primarily through 211. So if you know of anybody who needs help, has lost their job or had their hours reduced because of the pandemic, please refer them to 211. We've been able to provide through our United for All Fund, which so far for Spartanburg, Cherokee, and Union counties, we've raised over $100,000 for that fund to help families. Many of them have lost their jobs, had their hours reduced, or they're small business owners who are being hit pretty hard by this. They're reaching out for, utilities and rent and mortgage assistance primarily, as well as food. And so we've been able to provide financial assistance to help families while they were waiting for their unemployment insurance to be approved and go through. That process has been slowed down and taking a while. So we're trying to help people in the meantime to fill in gaps. The majority of the families who have reached out so far have been from Spartanburg County, but we have seen in Cherokee County quite a few families reach out, and then a couple in Union County as well. And we again anticipate for all three counties for it just to people to continue to reach out and to continue to increase. One of the things that I think has surprised all of us throughout this process is that the majority of people who are reaching out for assistance are people who've never had to ask for help before. They are new to the safety net system. I know that for the people that are community resource coordinators and the families they are helping, the vast majority, 90% of them or more, have never asked for assistance previously, or it's been over a year since they've asked for assistance in our community. And we're tracking this through an online case file system that we use called Charity Tracker. So that's been an additional barrier and challenge that these families are going through. They've never had to ask for assistance before, so they don't really know the system, they don't know the resources, which is why resources like 211 are so important, where people can go say that they have needs and then be connected and referred to multiple agencies that perhaps they didn't know about before. And then another thing that has been surprising to us is the number of families living in motels that we have that are seeking assistance now. We of course know that people live in motels in our community, but the number of them who have reached out, who previously were stable and self-sufficient and able to maintain and afford that motel, living in a motel, and now are reaching out and seeking help for the first time has been surprising. I think so often we think of those families as using the safety net system a lot. So it's been surprising to see new people come through who are in that situation. So those are just a few of the things that we're seeing. Please put any questions that you have in the Q&A box or in the chat, and we'll be sure to address those. But I'll turn it back over to Heather really quick for her to share where we have some resources on our website.
Yeah, so if you go to the United Way website, we have an entire COVID page. So it not only talks about things and links you to things from a statewide perspective, there's a lot of local resources on there as well. So a couple of things to make sure that our direct service friends know about is that on our page, you can link directly to that 211 COVID form. So if you're working with someone who might have a barrier to accessing 211, you can actually complete the form for them. So I think, thanks Hannah for doing that. So this is the page. You can see right at the top under resources is the 211 information. So if you select the form, you can help them fill out that form. Further down on the page, we give local resources that are broken out by county. So you can access those as well. Wanting to try to keep folks as up to date as possible. One thing that you will see added to the website late next week is we're going to have a link for just behavioral health resources. So we know that all of the new challenges that COVID-19 has brought to us, thinking about how we're struggling with maybe some isolation or not being connected to those humans that we love in our lives. Imagine if you were struggling with a serious mental health issue. So imagine how compounding that would be to all of the other fears and concerns that you have. So we wanted to make sure that all of our partners that are providing behavioral health services, but maybe just in a different way, that people could access those as well. So you'll be seeing that come up later next week after we gather all of that information from partners. But Hannah was right. Lots of new folks that are reaching out for help. We're really trying to get the word out about 211 and that we have assistance, particularly in Cherokee and Union counties. you would think with the size of our communities that, and how well we all know one another, that we know about all those resources, but 211 is still a big secret to a lot of people. So we need to make sure that that number and that resource is getting out to folks, and that they know that there's a way to reach out to get connected to help. And I'll pass it back on to Paige. You're muted, Paige.
Well, I thought I had, thank you. I thought I had unmuted myself. Okay, so I'm going to share my screen with you. One of the really great things that always comes out of, difficult times are really fabulous partnerships. And this past fall, we had begun some partnerships across the state between, and it was the first time ever, for the South Carolina Grantmakers Network and the United Way Association of South Carolina, which is the statewide association member organization for all of the local United Ways, as well as Together SC, which is the statewide nonprofit member association. All of those came together to begin to work on the census, and that had just been a great partnership. And so from that, we have continued that partnership as it relates to this COVID-19 response. And so back in 2015, when the floods hit the Midlands, the governor, then Governor Nikki Haley, reached out to the Central Carolina Community Foundation and asked them to establish a fund that would be there to be activated in times of crisis across the state. And so when hurricanes have struck, those kinds of things, that fund has been there to be activated. And traditionally in the past, it has only given grants to one individual organization. They really have not entered into making grants to community collaboratives. But it is so exciting to see those three entities, the Grantmakers Network, Together SC, and the United Way State Association, come together and for those types of grants to be made. And I'm excited to say that as of today, 2.6 million have been raised. And let me see if I'm going to stop sharing my screen so I can see my little list here so you'll know who all has actually been supporting this. For those entities that had statewide footprints, they wanted to be able to make a gift that was going to impact people across the state. So Duke Energy, the Duke Endowment, Dominion Energy, Haley Family Foundation, Blue Cross Blue Shield of South Carolina, Delta Dental, Truist, Harbor Freight, Bank of America, Wells Fargo, the Fullerton Foundation, Sisters of Charity, South Carolina Physicians Care Charity, the Lipscomb Family Foundation, and then 55 individual donors have given to that fund at this point in time. And so yesterday was the deadline for the first round of grant applications. United Way of the Piedmont submitted an application for the maximum amount, which is $75,000, that would be able to address basic needs such as food, utilities, rent and mortgage assistance, the hotel stays as well. And so that application has gone in. It will be for the 3-county footprint that we cover, Spartanburg, Union, and Cherokee. And we should be hearing something, I would anticipate, like next week or early the following week in regards to how successful we have been with that grant. But as those dollars come back, many of them will go to nonprofits, and then there'll be a small pool that is in Union and Cherokee specifically that will be focused in on the utilities and rent assistance as well. So we're excited about that. And I'm going to share my screen again. And we're going to talk about from a local perspective. So you heard Hannah talk about the United for All Relief Fund. And so we launched that at the end of March. And this will be similar to the 1SC fund, where it is a fund that will always be there, but can be activated as different emergencies occur. And so I'm very proud to say that as of today, we have over $190,000 that has been committed. And those are from corporate and community partners. Some of those partners, the very first one that stepped up was Truist, and that was actually through a gift that they made to cover all of their states, which are across the eastern seaboard and in the southeast. And for those of you who don't recall, Truist is the merger of BB&T and SunTrust. And so they made a $3 million gift to United Way Worldwide, and then they used 211 data to determine how much was going to each market. So that was our initial gift to get things kicked off. We've also had support from Keurig Dr. Pepper, Bank of America. The Timken locations in each of the counties have all made recommendations for us to be to receive funds for those counties. We've already received notification on the dollars for Cherokee County, so we're excited about that. Carolina Alliance Bank, the Johnson Group, the Fullerton Foundation has provided us funds for specific use in Cherokee County. One of the really great surprises that we had this past week was we received notification from a foundation that is well outside of South Carolina, and they notified us that someone, and we do not know who, made a recommendation for us to receive a grant from them. And we had no clue how much it was going to be. And on Wednesday night, I received an email that let us know that we were receiving $50,000 from outside of this community for work in this community. So that was just absolutely a high point. And another high point from last week that we are very excited to announce today is that the Mary Black Foundation is providing a $25,000 matching grant for us. And so we will be launching that matching gift program. So all gifts that are coming in will be matched dollar for dollar. So if folks are interested in seeing their impact doubled, I would encourage them to reach on out, utilize the donation form on this page, knowing that those dollars are going to impact the lives of people in this community. These dollars are all going toward that direct assistance and making sure that folks are prepared and ready to meet whatever challenge that they might be facing. You know, initially what we've said is that it would be addressing things like food and rent and utilities. But what we recognize is that this is a very different type of emergency disaster response than what we've had in the past. Unlike a hurricane, you can't look and just see the devastation. There's a lot of hidden challenges, and those challenges might not surface until several months down the road. And so we're trying to make sure that we are prepared and, you know, based on the responses that we've gotten to this point, I do believe that as much as 190,000 sounds like a really big number and enough to address the need. I feel like that we're probably going to, as always, the need is going to outstrip the resources. And so we want to make sure that we are as prepared as we can possibly be. I will share from a statewide perspective, when you look at the dollars that have been raised by the 1SC fund, as well as all of the different individual community or regional relief funds at this point in time. As of Wednesday, the dollars that had been raised were $6 million. And so we think we are on the way to being prepared, but recognize that there's still going to be additional challenges ahead of us. So, and I had someone ask about the match from Mary Black Foundation. Wanted to make sure that they had heard it correctly. Yes, the Mary Black Foundation is giving us a $25,000 matching grant. So for every dollar that an individual or a corporation or a foundation might give, another foundation might give, those dollars are going to be matched dollar for dollar. So we hope that many will step up and join in. We've already seen through our QGive link on our website, we've already seen well over $5,000 come in. We've had an effort on Facebook that has been going as well. And, you know, dollars are coming in, but we're hoping now with this matching grant that we will see even more that is going to be able to happen because of people's generosity. And I'll just highlight what Heather has put in the chat pod, that at this point we have already distributed more than $17,000 in assistance. And so that just lets you know how quickly that money comes in and then goes right back out. Any questions? Okay, well, I'm going to turn it over to Heather Lothar, and Heather is going to share with us what all has been occurring on the front of volunteerism.
Absolutely, and good morning, everybody. We have been working very hard with our nonprofit partners to put out the needs that they are having to our community. And so those of you who've been fans of United Way for a while will probably recognize our Get Connected website. That is where we are sharing all of that information as it becomes available. You'll notice that right on the very front page is our COVID-19 response. We also, just yesterday, in response to the incredible need for food, for our food pantries and our food banks, have a specific call out now for those COVID-19 related food needs. So if you click on Learn More, it will show you, we've got a general landing page just to share health and safety information, as well as to let our nonprofit partners know how they can reach us to get their needs listed, excuse me. And then if you click Yes, I want to volunteer, it's going to take you to our volunteer needs. These are being added as they come in and as we learn about them. For those of you on the call who are nonprofit partners, if you do not have a Get Connected account, you can simply email us and we'll get that up on the website for you. We're happy to kind of provide some concierge service with this website, because the last thing we want our nonprofit partners to have to do in the middle of a crisis is learn a new system. So we're providing all the technical support on the back end to get these needs listed and to keep them updated. So we have seen really good response out of this. And one of our favorite stories so far, and one that picked up a good deal of press, was about some siblings who saw the need for laundry detergent out at the Opportunity Center. And these two teens took it upon themselves to raise funds and go out and purchase laundry detergent. The goal was a partnership between Leadership Spartanburg and the Opportunity Center to get enough laundry detergent to do 2,020 loads of laundry. The Savannah and Garrett Williams were able to purchase and find enough laundry detergent to do over 11,000 loads of laundry at the Opportunity Center. And so we are just so encouraged by the fact that people really do still want to help. We have been very careful in the needs we listed to make sure that they are safe to do right now. So that means they're either virtual, or they're the kind of thing where you can pick up something and drop it off at the nonprofit who needs it without necessarily having to have that one-on-one contact. Or they are things where you're actually providing a service to someone. One of the biggest needs we have right now is people to help deliver meals for our Meals on Wheels and Mobile Meals affiliates. And they're doing porch drop-off. So those things that are kind of service delivery, we're making sure that they're being done in a way that is safe and that preserves our social distancing deadlines. And we're really proud to be able to say that our nonprofit community has been incredibly proactive in shifting the way they do service to meet those recommendations and guidelines from the CDC and from DHEC. And so we're able to post almost everything we come across because people have been so responsive at shifting the model of how they do direct service. We're also posting some things that are not local, but that are national or even international needs. So one of those is a project called Be My Eyes, where volunteers work with individuals who have low vision or vision impairment to tell them what they're looking at through a phone app. So maybe describing, that's chocolate milk and that's 2% milk, or helping them navigate a sign that maybe is difficult to read. So we're also including projects like that you can do right from your own home. And that it's really helping people who have those needs right now. So we really encourage everyone who's interested in volunteering to check out those needs and to look there first for what people are asking for. And we also are asking our nonprofit partners and the community at large, as you hear about needs, to share those with us so that we can make sure that the word gets out and we can help meet those needs. Because as Heather Witt and Hannah and Paige have all mentioned, this is such a great community because you say you have a need and people jump in to fill that. And so we're really proud to be part of that community and to help make some of those connections for our folks. I'm checking the chat box in the Q&A. It doesn't look like there are any questions yet. And Carly has posted the link to that volunteer page in the chat box. If you're looking for that, that's where it is. All right, I'm going to turn it back over.
So I'd like to open it up at this time. We do have a little bit of time. If anyone has any questions at all, you can put them in that Q&A box, or you can drop them in the chat and we'll get to it.
There's a question that I think Heather Lothar can answer most easily because I think she mentioned it on a call yesterday. Heather, will you answer that live?
Yeah, absolutely. So the question was around when South Carolina will recognize gig workers and the self-employed to be eligible for those benefits through the CARES Act. That's those expanded unemployment benefits. Essentially, the answer is they're waiting for the federal government to release those funds to the states, and that has not happened yet. Our best estimate at this point, and this is what they just shared yesterday, was that they're anticipating those funds will be released the week of the 25th. So a little more than a week from now is when they anticipate that. Of course, as with anything where you've got to coordinate between a state and a federal agency, there could be some hiccups there. But I do know that the due staff is working very, very hard to get those claims processed and ready to receive funds as soon as those funds are released.
Okay, good. We did have a question earlier about are any of these resources accessible through a phone app? And I know we've talked about a lot of different resources. And so I just wanted to answer that. We've kind of got a hub on our website, which is not necessarily an app, but is mobile friendly. But I wanted to open it up to our panelists and say, and just ask, are there any apps or things that you would recommend people looking for resources go to?
Well, SC 211 actually has an app, so you can either call or you can go online to sc211.org, or you can download the SC211 app and be able to access those resources.
Okay. And Heather Witt mentioned earlier some mental health resources that will be on our webpage later. But that will also be in the form of an app, I believe, through our partnership with Sharpen Family.
So I put the website to Sharpen Family in the chat pod. Sharpen Family actually already has resources directly related to COVID, but there's also a lot of great resources for parents talking about mindfulness and stress reduction, but also how to teach your children mindfulness and different stress reduction. If you have a young child and they're not able to go to school, particularly that 0 to 5, there's a lot of information on there about early childhood development. So just lots of great resources, and I put that link in the chat pod, and it'll take you to where you can download the app.
Any other questions at this point? I'm not seeing anything come through. I was going to ask Hannah, though, to speak a little bit about, I know there have been questions about how the Hispanic community is dealing with COVID-19, and I know we're doing work in that area. So Hannah, if you'd speak to that a little bit.
I will just say that if anyone who has a language barrier, a Spanish-speaking person needs assistance, we are partnering with PASOS, which is headquartered at Upstate Family Resource Center. They are able to help families do the intake process who perhaps have that language barrier. And then from there, we can connect them to United for All assistance as they go through that process and are deemed eligible. So we do have a process to help those. So if anyone comes into contact with someone who has that language barrier, Spanish speaking, please refer them to PASOS, or you can give them our contact. We'll make sure they're connected so they can also access the funds.
Okay. Great. And thank you, Nancy, for letting us know that you have Spanish speaking staff as well who are willing to help. That's great to see. Well, if I'm not seeing any other questions come through in the question box or in the chat, so we may end here a little early, but I'll open it up to our panelists if there's anything that they thought of throughout this that they want to mention quickly before we end.
I will just mention, because I know we have several partners who are on the phone that or on the webinar. If you have resources that you feel like are very applicable to this time of COVID response, please send those to us so that we can do a couple of things. One, so that we can list them on the web, on our website as a resource, but then also so that we can drop it into those folders that are going out for those community calls, because that's something where people have access all the time. And so they're able to go in and out of that folder. And so in addition to the notes from the calls, we've got information from DHAC that can be distributed, those kinds of things. So if you've got resources to be shared with others, we would love to be able to do that.
All right. Well, thank you all so much for attending this webinar, this virtual coffee and conversations. Oh, Paige.
One more
yep.
thing I was just going to say is I just wanted to reiterate, because I know that some folks joined maybe a little after I had said this, but if you are interested in receiving links to the folders for Spartanburg, Union, and Cherokee County and that coordinated response, please make sure that you indicate that in the chat pod and put your email address so that we can send that out to you.
And I'll also be sending sort of, we've listed a lot of resources, a lot of web pages. And as I mentioned very early on, this is recorded. So this webinar is recorded. So I will send out, if you registered on Eventbrite, you will get a follow-up email to all of those pieces. But with that, I don't see any more questions. So I think we are going to call that Coffee and Conversations virtual one and done. All right. Well, thank you guys so much for.
Thanks so much. Bye.
Yeah, bye, guys.